everybody. Welcome to Riverside's little podcast here, meeting with providers here in our Northern Virginia-based practice. I'm Topher with marketing and kind of some of the digital stuff, and I'm here with Chris Wheatley. Chris, how you doing?
I'm well. How are you?
Doing well. Thanks for joining us. And as we briefly talked before the call, it's kind of a meet and greet and trying to let people who are stumbling across our practice and looking for help learn who the providers are here and learn a little bit about you. I guess jumping right to it, Chris, what is your title? Actually, I'm not even sure I know. What's your title and kind of how did you get into this? If we could kind of background into where you are now.
Sure. So I'm actually one of the psychiatric nurse practitioners here at the practice. And I started in mental health way back. It was like 2008, 2009 at MVMHI, which is one of the state hospitals, state psychiatric hospitals in Fairfax. Actually, I think, as I recall, it's right behind or right next to Inova Fairfax. And this was like a really good, I think, place to start. It provided an excellent foundation, in terms of, developing, knowledge, understanding of working with individuals who have mental health issues, and that's really, and from there, I ended up at another state hospital, though, but the population was very different. It was individuals with severe, profound intellectual disabilities, and I worked there for several years, and then I sort of just continued to sort of bounce around at different facilities. I branched out to child and adolescent mental health at Children's National and Dominion Hospital. So, over the past, say 15 years or so, I've been really all over the place in terms of, the specific type of person or individuals that I'm working with, across the spectrum of different ages. Yeah.
Cool. I mean, I would imagine that gives you quite a breadth of experience with things that are kind of general and to very severe.
Yes, absolutely. And I think typically looking back, the sickest patient, I would say, were typically at the state hospitals that I worked at. So the acuity there was typically much higher. And so, in this sense, I think now that I'm working only outpatient, when people come in with, or happen to come in with more complex psychopathology or, more significant or serious issues, feel very, comfortable kind of managing those situations. So that experience has been proven valuable to me. So.
I'm sure. Well, we're lucky to have that, around our offices, the capability to manage things like that are quite involved and probably quite technical and hands-on.
Yeah.
As you came into Riverside, I guess, it sounds like you've been native to this region for a while. And so I like to think of it as helping out your neighbors, is kind of what we do. And the neighbors the folks that you treat that come in from, our neighborhoods here at Riverside, what's percolating? What are you generally treating around for patients that come in our region? What are you seeing in Loudoun County?
A lot of depression and anxiety. Especially with whatever, what's been going on with lately with the federal government. I've been seeing lately a lot of people who have been laid off or, lost their job, based on, again, what's been going on in the federal government. And, this has been very challenging, I think, for a lot of people. And so I'm seeing a lot of, reactive or depression and anxiety as a result of that. Of course, with children and adolescents, I see a lot of kids. It seems like academic demands, the stress of school is only ever increasing. And so I see a lot of young people here who feel in some way overwhelmed by the whatever's going on at school. And so predominantly depression and anxiety. I do see a little bit less of like bipolar depression. I typically do not see individuals in the office here who are manic. Maybe I do from time to time see a little bit of hypomania and a little bit of psychosis, but really usually it's just anxiety and depression here, and a lot of actually by the way, ADHD too. I see quite a few people who have are coming in for evaluation and treatment of ADHD, and that's very rewarding, by the way, to work with those individuals as well, because you typically see the medications. There are lots of medications out there for ADHD, and you typically see pretty good outcomes. When with people who who come in and they're struggling, with cognitive issues, and maybe they're struggling academically, and you provide treatment, and you really see in a lot of cases huge impacts from that. So it's really rewarding.
That's awesome. And that makes sense. And I would think that they kind of get their life back a little bit in both of those cases, in the depression and anxiety cases, and like you said, the market improvements that you see with ADHD treatment as well. They kind of can function better and get their life back, and kind of some of their I like that a lot. On the depression and anxiety front, and then we'll get to ADHD. What's the course there? I mean, if I'm coming in and I'm feeling blue, or I just am not, no wind in my sails anymore, like what can I expect from treatment? If say I'm a moderate case, what can I expect as far as what you would offer, as a first step?
Well, I kind of consider my role first and foremost as in a lot of ways as an educator, because when somebody's coming in for an evaluation, a lot of times, they sometimes they come in with sort of already preconceived notions and ideas about what they want to do for treatment. But in a lot of cases, people come in and, they just want to know about their options. And so I typically, once I've completed the evaluation, based on the clinical presentation, I will make recommendations. And in many cases, most cases, that includes a psychotherapy component, and in many cases, I'll offer some sort of medication, pharmacotherapy as well. And so when you're thinking about outcomes, right, you have to think about, okay, well, if the individual is willing to engage in treatment, willing to participate in psychotherapy, willing to take medication, again, in many cases, there's a positive, a good outcome, but a lot of it is contingent on the individual's willingness to engage, right, and where they're at in terms of whether or not, again, they're willing to participate in these different kind of treatment modalities. And some people come in, and I talk to them about medication, I talk to them about psychotherapy, and they say, oh, well, I'm not so sure. And I say, okay, it's no big deal, think about it, read about it, and, go get a second or third opinion and come back and see me. I don't really believe in, some people, I think, take a different stance, but I never try to pressure somebody into one or these different treatment modalities. I always just tell them, here's the information, and you can make up your mind, of course, at your own leisure. So
that makes sense. And I could see there being a couple routes in to do the right thing. I know some people are drug resistant, and I think that having the psychotherapy component and just being able to be there for them as an educator can be half the battle. Feeling like they have an ally in the journey to figure out what they need is a good step forward.
Well, there's treatment resistance, but I guess, for me, the key factor is what is going on, like from the psychodynamic perspective, what is going on sort of that's like, underneath the depression or underneath the anxiety. And so when you think about the kind of medication model of treatment, that component has been, I think, somewhat lost, which I think is unfortunate because, again, you always want to get at what's behind, the issue. And so in a lot of cases, in many ways, psychotherapy is key, in sort of figuring out what's going on, behind the scenes, or what's driving the anxiety, what's driving the depression. But sometimes, again, you'll get these, I'll see these individuals, and they'll have like a true endogenous depression where there's nothing going, their life is fine. It's in many cases great. They're successful. They're, they have, they're physically healthy. Everything in their life is going pretty well. They just wake up depressed, one day.
Yeah.
And so that's, those individuals, again, I tell them, please, again, we have these treatments available, and I almost always offer them some sort of medication, to help them. And again, if people are willing to engage, and there's lots and lots of treatment options out there for depression now, and so that's a great thing.
Indeed. Well, on the ADHD side, let's say, I'm coming in, and I don't want to, we don't have to go down a rabbit hole on the prevalence of it and just how much we're hearing about it these days, and where, if there was a genesis to that, upswing, or what, if it's technology. I mean, I don't want to go down a rabbit hole, but I kind of want to go down a rabbit hole.
Sure.
Say, like, what happened, man? Why is it everywhere? And is the treatment manageable? Should everybody that's finding this behavior in themselves be looking to remedy?
Yeah, well, not necessarily. I'll give you an example. Yes, awareness of ADHD has dramatically increased, I would say. A lot of that, I think, is due to social media. But, I've seen a few individuals, I think, at least this year, who were coming in for ADHD evaluation, and, in all these cases, it was a hormonal issue. And so when people come in for ADHD evaluation, what they don't realize in a lot of cases is if you open up like a book about mental health, right? Like the DSM is one example, but there are other examples. But and you look at all these different disorders, cognitive dysfunction, kind of speaking very broadly, poor focus, concentration, is a component of all kinds of different disorders, right? So a lot in some cases, people come in and they think they have ADHD, but it's really something else, right? And again, that's an opportunity for me to provide education and say, yeah, well, there's this other stuff going on, it sounds like, and so you always have to take that into consideration. But again, in many cases, people come in, children and adults, right? Because ADHD is the way we think of ADHD, it's a childhood onset disorder, but in some cases, not in every case, but in some cases, the condition progresses into adulthood. So I see a lot of adults too who are coming in and they go, I've got this stuff going on, what do you think's going on with me? And they do have ADHD, and again, there's lots of treatments out there, and people typically respond very well. And so, I enjoy working with, with people who have ADHD for sure.
That's cool. I mean, that's interesting though. It's like, it could be I guess, cognitive, function and or lack thereof could be indicative of a lot, maybe. A lot more than most people realize.
But
Yeah.
so again, that's the value of having, an evaluation,
Yeah, that makes sense. That makes sense. Well, I think for today, I mean, those are two pretty big swaths of people, I would assume, with who you're seeing. Our neighbors dealing with depression, anxiety, and ADHD. I guess broadening it out and just kind of putting up your grid a little bit. Who do you see? Age ranges and maybe what people are experiencing. Like, who are your clients, and who do you think you'd be a good fit for? I guess.
So I see children 6 and up,
Okay.
typically, and all the way up to usually about 60, 62 perhaps. And within that age range, again, I see the whole gamut of a variety of different mental health conditions, depression, anxiety, bipolar disorder, some psychosis in some cases. And so, I really, but again, typically the people who are coming in to see me, they're looking for, answers to kind of like what's going on with them. Why are they, experiencing depression? Why are they experiencing anxiety? And it's a lot of people who come in, they'll express relief actually in some way initially during the evaluation. Oh, I didn't realize it was going to be this easy. Or, oh, I thought it was going to be a lot more stressful than it is, because when people come to see me, I tell them in many cases straight off the bat, there's no wrong answer. Because the right answer is whatever you're thinking and feeling, and so I try to make it for every person, very sort of low stress, low demand. And I tell people, they'll come in sometimes, they'll say, I don't know. I'll say, I don't know is okay. If you don't know, we'll try to find the answer together. And so sometimes it'll take, again, especially with children, because we're talking about what sort of age range, children aren't always super reliable as historians. You rely on the parents, but sometimes, so sometimes it takes a couple of visits, to kind of get a complete clinical picture about what's going on with the person. And so when I'm thinking about the, different, populations of people I'm working with, children in this way and adolescents in this way can be, in some cases, a little bit more challenging. But I really do enjoy working with children and adolescents as well. So I see a lot of different kinds of people, really.
That's awesome. That's
Yeah.
awesome. Well, is there anything you would, say to somebody who was, on the fence about, I work with the intake team a lot here, and kind of some of the people that are on the front lines of the phones, and so you hear hesitation at the very beginning of people who are new to seeking care for mental health. There's like this hesitation. So somebody that says, is Chris right for me? Is seeking mental health right with Chris Wheatley right for me? Like, what would you say?
I would say that really depends on the type of care you're looking for. If you're not sure what it is you need, absolutely come in and see me and we'll talk about it. It may not be the exact right thing, but if it's not, I can point you in the right direction. Now, as in that vein, if somebody were to call the front office and say, hey, I'm looking for comprehensive psychological testing. No, you needed to see a clinical psychologist for that, right? Would be a good example. But in most cases, if people don't know, and again, in most cases they don't know, come see me and we'll talk about it. And I'll try to help you any way I can.